Dr. Andy Gardner from University of Oklahoma, and I am in the geriatric medicine department in the College of Medicine, and I'm an exercise physiologist. And my research expertise is exercise training and testing and rehabilitating older patients with peripheral artery disease. And this is a form of heart disease, but it's in the legs primarily. So when patients walk, they get leg pain and they're limited by their walking, just like a heart patient might get chest pain when they exercise. The best treatment, ironically, for that condition is to exercise. The first line of treatment is medication and exercise and eating right, stopping or reducing smoking, basically living healthy, and exercise is a big part of that. One of our target goals is to obviously improve ambulation with exercise training, but also that we are hypothesizing that that improves quality of life, and if you can move better and focus more on your diet and all that, that modifies risk factors, decreases your triglycerides and your inflammation and your cholesterol levels, those types of things. So that all improves blood flow. The message is ambulate or walk as much as you can up to about the point you're starting to get the pain, and maybe a little bit beyond that, and then rest. Wait for it to go away, and then we repeat the same procedure. And we do a supervised program, or we did, and now we're focusing more on doing that in the home-based setting. So we can actually have patients wear a little monitor on their ankle, a fancy pedometer, basically a computer, and we can download the data for a month or two, see every step they took, during their training program, and if it was fast enough or not fast enough, and how many minutes and that type of thing. So we can revise it and tailor it to their individual need so that they're not walking too fast and inducing the pain too fast. Most of our research studies for intervention are 3 months. So we'll put them through about a 12-week walking program. And most patients, we have excellent compliance to this program. So on average, the patients perform about 85 to 90% of their total sessions, and about 80 to 85% actually finish the program. And so we recommend that they walk 3 times a week at least, and a lot of them actually do more than that, and they'll actually do more minutes than we actually told them to, because I think they're out and about and they say, well, we'll just get another 5 or 10 in. So yeah, so we have pretty good compliance with that. We see that the blood flow to the leg improves, and so that's the major reason why they're getting leg pain. So and it's not through the major arteries. So the major arteries are already sort of blocked a little bit, to some extent, and so that's why the blood flows low. But it's all the small little arteries and vessels that get better, and that cannot be fixed with surgery. So surgery will be able to correct the big blockages in the big arteries, not the little vessels. That's what exercise does. We see that the patients, if they actually walk a lot in the program, that they'll lose fat, and weight as well, but most of the weight is fat. We'll see also quality of life improves. We see typically walking ability just in the hallway, just regular walking improves. It's such a good success using this home-based exercise program that we're now incorporating that into basically all the studies. So we have morphed into our home-based exercise program, where we use these activity monitors that they wear, and we'll do that plus we're thinking about doing various combination treatments to go along with the exercise, like heart-healthy diet. I think the primary cardiovascular research that's getting published in the major medical journals and exercise journals is affiliated, and it's either funded or it has a direct link to what the mission of the American Heart Association is.